are 572-0383 and 572-0215. Rev-Up St. Lucia, the alpha of radio.
Doctor in the House brought to you with the compliments of La Place Salazon, Ultramat, the Labrie Cooperative Credit Union, and Tapia Hospital.
At Tapia Hospital, caring and competent obstetric consultants who will see you safely from prenatal care through delivery with a team of excellent pediatric and anesthetic support. Tapia Hospital, where the patient safety comes first.
At Labrie Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labrie Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramat. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramat, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramat.
It's delicious.
La Place Salazon is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Place Salazon, of course. La Place Salazon, Castries, Rosalie, Beaufort, and Soufrière.
It's delicious.
It's now time to bring you Doctor in the House live on Rev-Up St. Lucia, hosted by Dr. Leonard Surage. Dr. Surage, very good evening to you.
Good evening, Andre. Good evening, listeners and viewers and throughout the diaspora. I am Dr. Surage. I'm here to do a topic on Doctor in the House. Today, Tuesday, 5th of August, 2025. And today I have a special guest who has come from far away. She's Canadian, St. Lucian Canadian, and she's an audiologist. The subject of audiology is not one that we encounter often, and we don't have many people in that kind of field. So we quite welcome her. Her name is Laila Babahani. Babahani.
Laila.
Yes, well, I'll still get used to the name. So, Laila, thank you very much for being here, and quite welcome you to discuss a few aspects of audiology. Now, before I get into real audiology is the science of hearing and diagnosing adults and children with hearing issues, etc. So she will tell us all about her training and the kind of work that she does. So welcome, Laila, and tell me a little bit about your affiliation with St. Lucian, because you sound St. Lucian to some extent.
Thank you, Dr. Surage, and thank you, Andrew, for having me on air. It is such a delight to be here. I grew up here up until about age 18 and then went to Canada and pursued further education. I have my undergraduate in health sciences, and then at that time I did not know exactly where to go. It was quite broad, and I thought maybe speech language pathology, and at that time embarked on the term and the field of audiology, and that really interested me because growing up, it just felt like we were always in loud noise exposures and environments, from carnival, from any sort of parties.
But this is civilization now. It's pure noise and more noise.
Yes. Yeah. And so, but what do we do if we encounter someone with hearing loss? Where is the treatment? Where is the prevention? Where is the education? So the field really excited me to go further into it, and I've been in it for about 17 years now since graduation, with a master's degree and
in audiology, and just have had a wide range of exposures, from working with ear, nose, and throat specialists like yourself in the public sector with cochlear implants, and finally a few years ago decided to do more private. Still work with children and adults. Audiology is a science of understanding. We have a deeper understanding of how the inner ear, the cochlea, works, how it gets processed up to the brain, and how that message is analyzed and then for interpretation. We are the only professions in Canada who can diagnose children as well with hearing loss, and then we work very closely with doctors and specialists like yourself for treatment and rehabilitation. That's a tremendous responsibility, because if you can pick up a child that have hearing deficiency early, you can change that child's life completely.
Oh, tremendously. And there isn't any, we can eliminate any sort of stigma that might be associated with that child, such as having a mental delay, or like what we call here being slow or retarded. There's often misdiagnosis that can happen, and if we can earlier detect a child with hearing loss, then the chances of success of treating them, and then them having a successful life, engaging more in school and being more
productive. And certainly being able to take care of themselves.
Absolutely.
That is one of the hallmarks of anybody with any disability of some sort, is to be able to bring them to a level whereby they can take care of themselves. Absolutely. And not be a burden to family eternally.
And to society. And if a child is not properly diagnosed, if they have hearing loss and they continue on into school, oftentimes we hear a teacher saying that they're just troublesome. But if their focus and attention is not there, because the message that they're receiving from the teacher is not being loud enough, because they have now a blockage in their ear, whether it's from earwax or whether it's a middle ear infection or inner ear hearing loss, permanent hearing loss, how do we treat that? So it's so important to earlier treatment for more successful outcome for that child.
And it is critical, because there can be, if a child is not hearing early, it can be a correctable reason. Now, if you did not diagnose and begin to treat it, that child who has the potential of being anything they want to be may just fade in the background and just be dependent on society. So it is something that is extremely important. And also, I want to mention, I'm sure you would agree, that if the child in the first few days after birth onwards, if they are not getting the stimulation of noise in the air or sound, because noise is unwanted sound, so my noise may not be your noise. So if the child is not receiving that from the air into the brain, the nerves that supply it will shrink away.
This is true, what we call atrophy, or it sort of deadens if there's no auditory or hearing stimulation. Research lately, or in the past few years, have said the sound doesn't just stop at that inner ear. It goes up to the brain, where we can analyze and figure out, you know what, that's someone knocking on the door, that's someone calling my name. So it's all about brain hearing now. And so absolutely, it needs cells, if it's like any muscle in your body, if you don't use it, you lose it. I often
That's
use
right.
that. And
Yeah.
so it starts to shrink, as you said,
Yeah.
those nerves.
And it's happened even in the eye too.
Yes.
If a child or an animal or any animal is not receiving visual input after a certain time, even though afterwards they get all the visual input, the nerves have already shriveled away.
Yeah.
And so similar with air, if you're not getting the sound and so forth, the pathway begin to suffer and the nerves begin to shrink away or deteriorate. It's as simple as that. So it is so important for children to be receiving auditory or sound as early as they can.
And
But-
to get diagnosis, I just want to say, in Canada we have a wide infant hearing program in Ontario, and every child from the time they're born, they need to be they go
Evaluated,
through evaluated for
Right,
hearing loss. And definitely if they're not, if let's say they don't pass, then there's next step protocol.
Okay.
But if they need, let's say, a cochlear implant because their hearing loss is really poor and a hearing aid cannot help them,
Yeah.
I've had ear, nose, and throat specialists who maybe the family rejected it when they were younger, and now this kid is 20 years old and they want that implant device, but the healthcare had to turn them down, because basically what happens is that if they start to put a device on their ear, because they've gone 20 years without that
hearing,
stimulation, without hearing, it becomes almost distorted and very robotic, that they would not use that device. So in Canada, they've said if we do not provide a device to stimulate that brain earlier on, we're not going to waste our funding money on that patient who wants it 20 years later, because we know from research that it's just going to be noise in their ear,
that's
and
right.
they're not going to want it. And it's a very expensive surgery that they've decided we're not doing. So it is very important to have
The early stimulation.
earlier stimulation, detecting that child, treating that child, if it be a hearing aid, if it be maybe a tube in their ear because of middle ear fluid, and if it be a referral to an ear, nose, and throat specialist to figure out what the next steps are.
And the other thing also is that if the child is not hearing properly, then the child develops behavioral issues. They're inattentive, they are moody, they get irritated very fast, they are very troublesome, they are curious, but because they cannot communicate, they get into tantrum very early. So this hearing impairment or hearing loss can manifest itself in so many other ways that make you believe something else is the problem. And it's not unusual to label the child as hyperactive, inattentive, attention deficit disorder, and begin to blame them that way and treat them that way, when really what they need is to hear properly. So you understand that if we do not get this path very clear, there are many children that will never develop their full potential.
Absolutely. And then there's that stigma with okay.
Oh yes, yeah.
It's if it could just be hearing, then we can fix it. But now that child is completely misdiagnosed, like you said, having maybe autism or ADHD, attention deficit hyper sensitivity disorder. So how do we attend to that child? How do we get them to better focus and zoom into classroom? Well, if they're hearing, if they can have if it's, let's say in the case of they need a hearing aid, we put that hearing aid on that child, we bring them closer to the teacher. If it's just maybe sometimes they have one ear that has hearing loss, often research has shown, well, one good hearing, they can still function in school, but accommodations need to be made in the classroom, such as having maybe carpets on the floor to reduce to improve that signal over the noise. So to make the teacher's voice louder and clearer, because the carpet will absorb the sound. As we know, classrooms can be very noisy, or have wall hangings, or the teacher wears a little microphone to put with speakers in the classroom so that her voice can project much clearer, and that will be very beneficial for a lot of kids.
That's FM.
Not just FM, but sound field FM as well. Even just a basic little microphone a teacher can carry around her with a little speaker attached to the classroom, and to make the classroom a little bit louder with her voice projecting, of course, and not... Because when you get in a classroom with a bunch of little kids, it becomes very noisy. So to get their attention and focus better in school. And for that whole academic success. So they're not dependent on their families and government for assistance, that they can become more independent, find work later.
Okay. So if I am a young parent, have a child, and I'm not too sure if my child is hearing, for one thing, I would like to know from the time they're born whether they're going to hear or not. What tests are available in your armament of tests that we can do?
So it depends on the age of the child, Dr. Surage. So if they're babies, of course, they can't really... So the standard testing for ages maybe 4 years and older would be they hear a little birdie in their ear, they hear some beeps in their ear, we put them in a booth, we put some plugs in their ear, and then on the other side we go with our machine and we present different tones based on different frequencies. So from bass to mid to treble, so from low frequencies to high frequencies, and we test each ear. And if they hear the beep, they press a button. And even if it's very, very soft, that's the hearing test.
Right.
But that's ages 4 and
4+
older, as long as they have the capacity to follow instructions, they're not attention deficit, they don't have any other delays, that they can participate in that test. But for babies who are not able to do that response, what do we do? So we have more what's called objective testing, where we do not need them to respond, but we have testing such as the otoacoustic emissions, where it's more of an automated testing, and this is what's done. Once again, I use Ontario, Canada, but this is what's done at the hospital level. You just place a little probe tube in their ear. It sends a sound to that inner ear to reflect the function of that cochlea, and to test. It basically screens, does that child have normal hearing? And normal hearing is up to 0 to 25 decibels. If it comes back with a pass, we test each ear. They can be sleeping. Most times we want them to sleep or to be quiet, the baby, and then we test them, and yes, they've passed.
That's for the otoacoustic emission.
Otoacoustic emission.
So this test does not rely on a response from the child.
Correct.
The child is asleep, you do your test. It will tell you if the cochlea, which is the inner ear structure, whether it can receive sound or whether it can... whether it is receiving the sound.
Correct. And then there are other tests. Now, if the child fails, what do we do? And oftentimes we take into consideration, is there a parental family history of hearing loss? Does the dad or mom have hearing loss? Even if they pass in Ontario, like the standard should be, let's test them again maybe in a few months when they're 6 months old. But
so if they fail the first one, you retest them. Okay, it doesn't mean that they really cannot hear.
Yes. We just want to retest them and maybe wait a couple months and then retest them. But we want to always catch them before at least age 1, because that's when really they start to, even by age like 8 months old, they start to use different sounds. It's not just ba 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 ba, it's ba 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 ba, ooh, ooh, ah, like different sounds that they use. And so we know that they're hearing when they use this variety of tones in their trying to communicate with us. But there's other testing if they fail, and I know you have a little bit more, some experience and knowledge, auditory brainstem response. So they put electrodes.
So what you do in that test, you put a click sound where the child should be asleep or sedated or quiet. What you're looking for is how does the brain respond to a sound put in the air. Because the sound will go in the air, into the nerve, and the nerve have different stations, different parts of the brain that the signal passes until it gets to the cortex where you hear. There are about 4 stations, and each station have a certain distance by which the sound should travel. I'm not going to get more complicated than that. So essentially it is, you put a sound, a click in the air, and wait to see if the brain gives a signal that it received the sound. And then you can, then you can know, yes, this person is getting the signal from the air into the brain. So they have hearing. And they can even tell you percentage-wise how, not only qualitatively, but quantitatively, what percentage, average percentage they have a 60% hearing loss, 40%. So it can give you a percentage. Whereas the autoacoustic emission will give you a pass or fail.
Yes.
This other one will give you the amount of hearing they
The
think
degree.
that they have.
Yeah, whether it's like a mild hearing loss or a moderate hearing
Right,
loss or moderate severe hearing loss, and then what the next steps are.
Yeah.
So just a quick question, Leila.
Yes.
These hearing issues, do they start during pregnancy, or is this something that the child develops outside of the womb?
So it can definitely be during pregnancy if the mother maybe had a virus, maybe rubella or
cytomegalovirus
yes.
or any of these viruses.
These bigger unknown viruses, that's a cytomegalovirus, or also meningitis. Like viruses can
Meningitis is a good one.
Yeah.
Meningitis, because almost all those I have seen when I was working in Scotland, the people with they had cochlear implant, they had meningitis either in one ear or in both, and it damaged the nerve for hearing.
So that meningitis is passed on from the mother?
From the mother, like
Yeah.
The
through
child?
the blood, and sometimes it can be upon like delivery of the baby, or if there's a genetic component, like the mother has hearing loss, there's a higher percentage that child could also, so family history of hearing loss.
That's right.
And sometimes, a lot of times actually, doctors are scratching their heads going, we don't know what caused the hearing loss, it's an unknown cause, we now have to deal with it.
That's right.
So, yeah.
So let me when a woman is pregnant and say she goes to a health clinic,
Yes.
right, every few months, aren't they supposed to check for all these things?
It's very...
They actually do to a large extent. Our prenatal care here is quite good. They would look at or if you have...
I mean, during the pregnancy, Dr. Surage?
Oh, yeah, because you remember that as soon as you're pregnant, then you report to your doctor. And then they check it by weeks. We don't talk about months and lalin anymore. It is a 40-week cycle for the gestation of a child, plus or minus 2 weeks on one on either side. So, and the mother will be coming to clinic if the mother has risks, high blood pressure, diabetes, whatever, kidney failure, whatever they have, they may be seeing the doctor more often. But there is a reasonably good service when it comes to antenatal, prenatal. If they don't do it, it's because they are careless, not because the service is not available. And so they would pick up infection there. And the other thing is that sometimes medication, some antibiotics can cause that, can cause damage, both defects and damage. So that's why the doctors are so cautious. If you have, especially in the early pregnancy, the first term up to the first 22 weeks, etc., they're being very careful about that, what antibiotics to give you. And that is why they would tend to make you, rather than giving you antibiotics or medicine that might interfere, maybe you can put up with a little discomfort. But they've been very careful not to give you antibiotics and stuff like that.
But I think going back to Andre's question, I don't think it's possible to test or to detect hearing loss in the child from that 0 to 22 weeks or 40 weeks.
Inside the uterus?
Inside the
No.
womb.
Is that what you're asking?
Were you?
Both, actually.
Yeah. Like when they do ultrasounds on the mother, they can somewhat. We know that the ear doesn't form until I think around, if I recall in school, around 8 weeks, 12 weeks of pregnancy. So they can sort of see from imaging how that whole baby is formed. But in terms of like to figure out do they have hearing loss upon birth, we wouldn't know until we actually do the otoacoustic emissions or the ABR
after delivery.
After delivery of the baby. Yeah.
And you're saying it's also possible that even during the pregnancy that there may be some issues going on which would preclude the medical professionals from recognizing that there may be a problem with the mother, right, and the possibility of passing this on to the child, which would cause the hearing loss.
And that's
so you're saying that they could also miss it?
I think a lot maybe, and Dr. Surage can comment, but if that mom, that's where they ask, oftentimes when you go to your doctor, they will ask first what medications you're on, and then making sure if those medications are what we term as ototoxic to the hearing or any other parts of the mom's organ or will affect the baby, then the doctor will then figure out, okay, let's remove that medication, put another one that's a bit safer for the baby so that they're not at risk. We know that cancer treatments and chemotherapy can destroy. So if a mom happens to be on chemotherapy and she's pregnant, well, then she'll need to maybe delay treatment because it is unsafe to the baby. And even as adults, chemotherapy is not safe because in terms of it is safe for treatment, but in terms of hearing, it can affect, it can cause hearing loss.
And even some air drops like the gentamicin and stuff. If somebody has or child has a perforation in the eardrum, we tend not to give them these medication because it can pass through the air, get into the middle ear and affect the cochlea. So we tend not to give that. And intravenously, no. You try to get other medication. So there are safe ones.
So let's just assume, dot your I's, cross your T's, the mother's on some kind of medication which could lead to those issues that you mentioned, right? Okay, assuming dot your I's, you cross your T's, is it also now still possible that after you have that baby could develop hearing problems for some other reason?
It could be, yes, absolutely. And that's where, like I mentioned earlier, a lot of times when they have hearing loss, they ask thorough questions, like very good question. Is there family history? What did you take during pregnancy? Like go through a very good history with the mom, but it could just be we don't know what's caused this baby to have hearing loss, and that baby could have a very mild hearing loss that needs a lower degree of hearing aid in terms of like less volume, or a very severe hearing loss, and now they need a surgery or an implant to help treat that.
Yeah. Now, just before we take the break, do you think that hearing issues, right, are just as common as, say, 50 years ago, where science was not as advanced as it is today, our understanding of how these things operate? I remember there's a story of, I think it's Stevie Wonder. I think it was just a simple, something happened, he was in the room where you have the babies, and he caught an infection, and he lost his eyesight, right? So we figure, okay, that was back then, people were probably more ignorant, we didn't know certain things. Now today, do you find that hearing issues are just as common? I know you can probably use Canada, maybe a bad example. So Dr. Surage, what is your, because you're an ear, nose and throat specialist, so what is your take on that? Do you think that we still have hearing issues with children or just people in general?
We do, except that our diagnostic acuity is better. We know more why they have the hearing loss. In the past, we were not sensitive enough to that, and we did not have doctors who were talking about that, and so the education had lacked a bit. So you find that not that the number of hearing problem has increased, but that you are finding you're diagnosing more of the things you never diagnosed before.
Okay.
Because we have better facility to diagnose, CT scan, MRI, audiology, hearing test, tympanogram, we have more things to diagnose. Before, you'd have a child having large adenoids that block the air, and the eardrum burst, and the air is leaking, and they take fry vete and put it in the air, trying to get treatment. So all these were happening, except that you didn't know why. So the advent of science and more different types of doctors are sensitizing people to the different illnesses. So whereas the numbers statistically may not have increased, but we're getting to know why it's happening more.
Okay, we'll take a break right now and come back in just a moment. This is Doctor in the House Live on Rev-Up Slu with Dr. Leonard Surage. The program is brought to you the compliments of Laplace Salazar, Ultramart, the Library Cooperative Credit Union, and Tapio Hospital.
Tapio Hospital Radiology Department offers 24-hour service. We provide you with X-ray, CT scans, and ultrasound imaging using the most modern equipment that produces the best images for your medical attention. Call the Radiology Unit at 459-2201. Tapio Hospital, where the patient's safety comes first.
At Library Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Library Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today, or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramart.
It's delicious.
Laplace Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? Laplace Salazar, of course. Laplace Salazar, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
This is the live broadcast of Doctor in the House with Dr. Leonard Surage. Dr. Surage is back to you.
Thank you once again, Andre, and thank you, listeners, for staying on and listening to us. I have with me an audiologist from Canada, St. Lucian Canadian person. Her name is Laila Baba Hani.
Yes,
I've got it right.
Laila
I'm
Baba.
getting there.
Yes.
And we are discussing children hearing loss and what we can do about it. It's not confined to children alone. We will, if we get a time, we'll discuss adults as well. But basically, the critical aspect of picking up children with hearing problem early, so you can make a difference to their life and they can realize their true potential. So we were just discussing the tests that we do for hearing loss, etc. Now, you can contribute to the discussion, because it's an open forum kind of discussion, by calling us on the fixed line at 572-9710, or you can shoot us on app and WhatsApp at 287-0971. So let's proceed. Yeah, we're talking about the tests that we do and the different hearing tests. Now, the test that is done after, not only in terms of hearing loss, but the problem that people may have. I think Andre was asking a question earlier: what can cause hearing loss? Now, apart from the nerve and being born with hearing issues, children develop large adenoids. This is the gland in the back of the nose, and that gland blocks the nose, and then the tube for the air is in the back of the nose as well. So these tubes get blocked, and the middle ear develop infection. Sometimes the middle ear may have glue, and I've seen that glue is like a tenacious, sticky glue that sticks in the air, and you have to do a special operation to remove that, so that the children can hear. And you may have to put ventilation tubes to replace the functioning of the eustachian tube. So large tonsil, large adenoids is a very common cause of hearing loss. And many children, as I was saying earlier on, many children, it becomes, in the older days, become middle ear infection, and it bursts the eardrum. So the typical scenario is that, doc, that ear was hurting me, and it was hurting me so much. And then I heard a pop, and it felt better, and I saw my ear leaking a little blood. It's not full blood, but a mixture of blood and mucus. And doc, I felt so much better I could sleep. So the eardrum has burst after under a lot of pressure, and that hole can either remain as a hole in adulthood, and I've seen many patients who have a ruptured eardrum, and when you ask them, they say, oh, when I was a child, I had a lot of ear infection. I thought that was over, but the drum never healed. But we can patch the drum and say, so that something can be done about that. But it just goes to show that causes hearing loss as well. And of course, there is a major problem with hearing loss, and that is to do with self-induced noise in the air. And at the very beginning, we were talking about noise and the era of noise. And this noise pollution is becoming a real problem internationally. It is being said that they expect people at a younger and younger age to be requiring hearing aids.
Absolutely.
And so I think that is an issue that is of concern to us.
Yeah, like we're seeing, instead of 65 years and older with hearing loss and hearing aids, I'm now seeing 40 years, 45 years old with that needs hearing loss. And a lot of the times, they went to concerts, they had loud exposure, or workplace exposure where they did not wear ear protection plugs. And there's standards in terms of if it's too noisy, then you should, after a certain level, should protect your hearing if you're in that environment for 8 hours or longer at work.
Because as we speak here, we are speaking at about 60 decibels. A decibel, by definition, is a unit of loudness, of sound.
Sound pressure.
60 decibel. And they are saying the international acceptance is that anything in excess of 85 decibels for more than 8 hours can be harmful for your ear. Got it right?
Yes, and then if it goes up to 90 decibels, then you should cut your time half in terms of from 8 hours to be 4 hours.
So it is a inverse relationship, not a straight line.
Yes.
Relationship. The louder the noise, the shorter the duration.
Right. And this would be people working more with heavy equipment or in noisy places.
Yes,
and that is a problem.
Like those workers, for example, you see them on the roads with those power drills, and they're going at it. I mean, when I pass by, I can't take it.
You can't take it. You don't ever pass by.
Yeah. But and you hardly see them. Some of them wear like sort of earphones. I'm not sure exactly what they are, but I know it's to protect their hearing. But others are just they're going at it without any kind of protection. Also, I wanted you to chime in on the issue of those powerful motorcycles as well.
I mean, they can go up to 120, 130 decibels. So really and truly, one should not be in that environment. And if they are, they should, I always say, double protect. So put some earplugs, custom earplugs, and then wear some earmuffs over the ear to really protect your hearing. And it's all about intensity and duration, being how loud it is and how long are you exposed. So the shorter, the louder it is, then lessen your time in that environment. Don't go at it for 4 hours or 5 hours. Go at it for maybe an hour. So less time if the level is louder. And definitely, I always tell my patients who are, even they think, when we're 20 and 30, we think we're invincible. It's not going to happen to me. You're never too young to lose your hearing. Like, you've got to protect your hearing.
I want to stress on those powerful motorcycles.
Yeah.
Again, I live in a neighborhood and we hear those motorcycles passing by. And it's just noise. And for the average person, I imagine they can't really stand it. But imagine the rider I'm talking about, the rider. And you're going at this thing as your main mode of transportation in some cases. And a constant, every day you're riding this thing. I mean, does that affect the hearing in any way?
It must affect the hearing.
It must over time. If they're maybe doing it for a year, Andre, okay, and they're just doing it maybe half hour every day or an hour, they may not see the effects as much. But if they continue for every day and they're doing it, I would say even an hour at that intensity where we've said now at 90 decibels 4 hours. So imagine now at 120, you really should not be more than 15 minutes, 20 minutes in that environment if you have no ear protection. If you do that every day for 2 to 3 years, you are going to see a shift of your hearing. You're going to, if you test your hearing before you start that activity, and then in 2-3 years later you retest your hearing, you will see. I mean, everyone individual, it's different. Like, you and I may be in the same environment for 30 years, and I may have a greater degree, worse hearing than you.
That's right.
But there will be some, there most likely will be some damage. And once you lose your hearing, the sad thing is it's irreversible.
Right.
Like, you cannot repair it. Even when people come and we fit them with hearing aids, they often say, man, I wish I never worked in that noisy environment, or I protected my hearing, or I didn't go to as much concerts and music festivals, because it's never as normal, as natural as your own normal hearing when you have a hearing aid. It's better than having nothing, but I often say it's like a cane. You're using it just to help you walk a little better, help you hear a little better, but it doesn't replace your natural good hearing.
I'm glad you said that because I've spoken to people who actually have a hearing aid and they're still having issues hearing what you're saying.
Yes.
And they actually have the hearing aid on.
Yes. And the difficulty often with hearing loss is having a lot of challenges hearing speech understanding in background noise, understanding conversations when there are 3, 4, 5 people speaking, and then you have loud music. So hearing aids do help. It depends how they are set. If they're set according to the hearing loss, if it's done by a professional and not just over the counter or online you buy it, it is an amplifier, but it needs to be set according to the range of the hearing loss that someone has. And it's still going to have challenges with understanding speech and noise. So it's never, and the emphasis really now should be on education and protecting your hearing, because you can't get it back.
You have a call, Dr. Surage? Yeah, you have to use the headphones. Yes.
Hello.
Good evening, Doc. Good evening, Andre. Good evening.
Good evening.
Dear lady.
Good evening.
Good evening.
Her name is Leila.
Leila.
Yes.
Leila. Okay.
Thank you.
Okay, Doc and Leila and Andre, thanks for accepting my call.
You're welcome.
Good.
Doc, can you
Talk to
say
me.
the air? Can you say the air is an organ?
Oh, yes. It is an organ.
Okay.
And an
Okay.
organ is a part of the body that serves a function and works independently.
Okay.
Like
So
your
if
kidney,
you
your
have a-
liver, Yeah, so tell me,
And it's an important organ, eh?
a very important organ that keeps you in touch with reality, with the world.
And we just learned that when you lose your hearing, you can't get it back.
Irreplaceable,
Yeah, irreplaceable. Wow.
Yeah.
And having problem with your air can affect your balance too?
Yeah. The air has two functions, to make you hear and to give you balance. And there are two different organs that do it. The balancing part are the semicircular canals, and the hearing part is the cochlea.
So they're very much connected, and they share fluid. So if you have a little bit of hearing loss, you could also have some balance issues. Every individual, once again, is different.
So you said that if you're having some hearing problems,
Some persons may
some
also
people
have
balance
issues,
issues.
or they may have first balance issues, and then when we detect their hearing, they have some hearing loss.
And that is why sometimes when somebody comes with a balancing issue, they are dizzy, they are imbalanced, if we tell them to do a hearing test, they don't fully understand why they should have a hearing test. Because the nerve for balance and the nerve for hearing pass very close to each other. And if there is something disturbing it, it will disturb both.
Yes.
Okay. So if you have a child, at what age does a child really hear noise?
They say in the mother's womb they begin to hear noise, don't they?
Yeah, like as long as everything's developing well, I think even 12 weeks, 13 weeks, they start to hear and feel, and more as they start moving around, kicking more as they become more fully formed in the womb of the mother.
Okay, because the reason why I say that, if you have a child about 1 year, 2 years or so, and you are beating an object by this child, and this child is not turning his or her head, can you say this child has a hearing problem at this age? Because, like, if you're beating something by this child, that child is supposed to hear and at least move his head to where the noise is. Can you say that's a sign of hearing problem?
And it depends, for sure, and it depends on how loud you're beating. If it's like a drum, if it's a pot, if it's just your voice going, hey, how are you? Can you hear me? And if you're far away, then that child may not hear. But if you're right close to the child and saying, Diana, can you hear me? And she or he is not hearing, turning,
or something is beating.
This is very concerning. Like, I would be if I was you, I would want to go and get the child tested, because this is the key time. You said the child is 1 year old, 2 years old. How old is this child? Sorry.
Between 1 and 2.
Yeah. This is the key time for speech development, even before 1 year old. And if they're not hearing speech, they cannot develop it. They're not able to then expand their language and vocabulary.
And my last question, since the air is an organ, and sometimes you have food, you have vitamins, you have nutrients for mostly all organs in your body, what not nutrients, vitamins can one
buy
eat
to make your hair sharper?
Right. Okay. I'll listen on the radio.
Thank you.
Thank you. I cannot think of any medication that is specifically geared towards making your air healthier. I think the important thing is not to do things that will harm your air.
And I think we need to find out what type of hearing loss, whether it's because of fluid behind the eardrum and they need to now see an ear, nose, and throat specialist, or whether it's something that is at the cochlea, that inner ear, and we need to now maybe test and maybe find a solution whether that child will need hearing aids for school learning, etc.
You have 2 calls on hold.
Okay.
So let's take the first one.
Go. Okay. Hello.
Hello.
Hello. Good evening. Thank you for calling.
How you
Yep.
doing?
I'm good, I'm fine.
Okay. Doc, I've been a patient. I'm one of the patients.
Okay.
I have this problem with my ear. As you may know, you have examined me many times.
Mhm.
I think twice or three times. Whatever. But I haven't heard you mention anything about sinus.
Sinus.
Sinuses.
Okay.
Yeah.
All right.
Because I think it plays an integral part in when you have an eardrum that is punctured or ruptured or whatever it is, or damaged. When the sinus is affecting you, let's say for example you lie on either side, the right side or left side, and if your left ear is punctured, your eardrum is punctured, and your sinus is acting up, wouldn't it be wouldn't the sinus, like if it's coming down, will it pass through the eardrum and pass through whatever channel into the air? And to get it wet all the time?
Unlikely. I'll tell you what. The air and the sinus are not related in the way you think they are. The air and the sinus, they respond to the same problem. So if you have an issue of allergy, the allergy will affect your sinuses. It will swell up the passage to your sinus, block your sinus, make it run, etc. And that same allergy will block your air tube, which is in the back of the nose, and make the air get blocked. And if there is a hole in the eardrum, the fluid or mucus will pass from the middle ear through the little hole onto your pillow. So it is not that the two are connected, but the same thing affect both of them.
I think that's what it's affecting, because my air is getting wet all of the time, especially when I wake up in the morning sometimes.
There may be a hole in the eardrum, and if if there is a hole in the eardrum, then it is a good idea to patch it so that it can be safe. Because
but that's what the problem is. I have taken a number of antibiotics and all kind of thing to
it will recur.
Dry up.
Yeah, and it's not drying up.
It's not drying up at all. So it will be difficult to patch up.
Well, if it is infected, it can be patched up. So in that case, you may require a scan to look at if there is any other disease that is lurking around and prevent that air from healing.
Okay,
so we may have to move to a higher level of investigation. Because you can have cholesteatoma, you can have other things that pockets of infection that is actually preventing the thing from getting better. So I think that's the way to move.
I realize like I'll be with someone speaking, and I hear myself speaking loud.
Yeah, because
but the person in front of me can hardly hear what I'm saying.
Oh, okay. Yeah, because
you know what I'm saying?
Yeah. So
people just wonder, like if they call me, like I'll have to turn my head up to the river from to hear or whatever. So I guess it's already affecting me that bad.
Yeah, but if you should not have an air that's not healing at all. That's not right.
It's always right.
So yeah.
Can I just suggest that in the meantime, caller, if you're taking a shower, you should really cover your ears, protect your ears, because if your eardrum has a hole, then water is not good for that eardrum because it will cause more bacterial growth and more infection, and then you're continuously taking medication, and the medication just you'll feel like it's not resolving.
True.
So
I block my ear when I bathe all the time.
And don't go swimming like underwater, and just keep that ear as much dry until you can get in to figure out, okay, how big is the hole? Can it heal on its own? Because if it's a pin-sized hole, Dr. Surage, it can usually heal on its own. But if the eardrum has a larger volume, a larger hole, then surgery may be needed and necessary.
I remember last time Dr. Surage checked it, I think it was almost like the size of a 10-cent piece.
A 10-cent piece, that's big on the eardrum.
Then we need a surgery.
No, I'm just exaggerating a bit, but that's how big a hole is.
Yeah, so but I think that maybe we should look at it in terms of doing a scan to see whether there's a pocket of infection hidden away somewhere, or a different type of disease that may be there. Because not all hair or not all hole in the eardrum is because of just an open passage.
Because the reason why I'm saying that, Doc, only like on the morning when I get up. Sometimes I see my air wet. Like, but during the day,
It's
my
not
air
running.
it's not leaking. It's not anything at all. Only when I lay down.
Okay.
And just check to make sure it's not just like it looks more mucusy, I would say.
As opposed to clear water.
Yeah.
Yeah.
Okay.
It's not clear water, but it's just it has no smell, it has nothing like that.
And sometimes it's also good to do a test, a bacteriological test, to do a culture sensitivity to see if a bacteria is growing that is not sensitive to the medication that we give. So there are things that can be done, yeah.
All right, okay.
All right, well, thanks for your call.
All right.
Okay, we have a final call.
All right. Hello.
Hello, good night.
Good night. Good night.
Dr. Surage.
Yes, talk to me.
About 7 years ago, I did a hearing test, and the doctor said to me, the specialist said to me, that my hearing is so bad if I was in a blast or something. And he said, pretty soon I will be needing hearing aids. But that's 7 years ago.
Okay.
But to me, my hearing is fine.
Okay.
My cousin always telling me I'm not hearing because she have to repeat herself. But I find if she speaks a little louder, then I'm going to hear her. Because right now I'm listening to the program, and I do not have it on a speaker, and it's very low, and I'm hearing every word clearly.
Okay.
So to me, in my mind, I do not have a hearing problem. But I remember, I know I like my TV loud. I like to listen to the radio loud. I don't think it's because I'm not hearing it clearly that I'm putting it that loud. It's just how I enjoy it.
Okay.
So if 7 years ago the doctor said that if I was in a blast because the frequency when he did the thing was so bad, you don't think by 8 years later down the line I should have been not hearing at all?
Totally deaf.
Yes, that's what.
You want to
because
Sorry, go ahead.
Go ahead.
Yeah, go. Yeah, you can answer me. I'm listening.
I just want to say, if it's 7 years ago, go and get another hearing test.
Yeah.
The second thing, if maybe you were exposed to a loud bang or a loud, that could be trauma to the ear, and maybe your hearing level shifted, and it's like a temporary shift that causes a temporary hearing loss. If you got, let's say you went to a party one Friday night or Thursday night and you went and got tested on Friday, your hearing could have shifted because of the loud noise exposure that you were in. So
because prior to that time I used to always attend the country and western dances.
Okay.
And that used to be on a weekend, just once a week. But then when I did the test, I had not attended any of the events really per se. I mean, I don't know, could have been that, but the way he said it was so bad at the time. To me, I don't have a problem with my hearing. My cousin always teasing me, oh, you better go and check your hearing, you're not hearing. Because I tell her she speak a little louder, but she tell me, look, somebody else is there and they heard her. I'm the one that didn't hear her. So I am the one with the problem. But I just don't want to accept the fact that I am not hearing, because I'm hearing fine. Look, I'm hearing you clearly there right now over the phone.
And ma'am, if you have one poor ear and one good ear, that good ear is working more for that poor ear. So if it's just one ear that has hearing loss, then maybe yes, you think you're fine because the good ear is what we call compensating. It's working harder to help you hear better. So I would just say the first step would be go and get your hearing rechecked, and you can find out where that is, and just figure out if there's a change in your hearing, if there's hearing loss. If there's not, then you're good. If there is, then then you.
Yeah, because I did it back home, but I have an appointment scheduled sometime this month because I'm in the US right now to really get it checked to find out if it is really okay. But I just honestly, I don't accept the fact.
Okay, the matter can be put to rest very easy with one hearing test.
Yes.
And it will make you feel better about yourself.
Yes, I will. Thank you.
Okay, nice hearing you.
Thank you.
All right.
Okay, we have to wrap things up, Dr. Surage.
Okay.
But just quickly, I guess just like the eyes, you could have one eye which is a lot better than...
Yeah, and it can compensate.
So, same thing happens with the ears.
Yeah.
You have one ear which is relatively okay, and the other one, as you said, is compensating
So if one ear is really poor, the challenges a person will have is understanding speech and noise and locating where sound is coming from. So if one ear is really deaf, they have a lot of difficulties locating sound. But the better ear can still help to help them to continue in their everyday until they can get maybe a hearing aid to help with that poor ear.
The reason I asked that, I thought because the ear was one.
Oh no, they're two separate, organs. You have a right cochlea and a left cochlea, the organ for hearing. And then how it gets sent up to the brain, there's a right auditory center, brain center, and a left one. And then it crosses over, and then the message gets sent back so that we understand that's Andre talking. So it's right and left.
Amazing.
Yeah, and
amazing.
What's equally amazing, and I'll just add that one as the last thing, the distance between the two ears is what determines the location of a sound. You'd be surprised that if the sound is on the right side, the right ear will hear it before the left ear. And that is why the brain processes that and tell you the sound is on your right side. That short distance between the two is what they use what the brain uses to localize sound. And if you have one good ear better than the other one, as Lila was saying, that it will prevent you from localizing, and that's important because a vehicle is coming and blowing the horn, you may look at the wrong side. It's very important.
And I just want to wrap up how small that organ is and how important it is. It is one of the smaller, very small organs, but important for one of our 5 essential senses. Hearing is one, vision, taste, smell. So it is.
In fact, the cochlea can be put on a 10-cent piece. That's how small it is. The little 10 cents.
And really important to protect
your
hearing.
Okay, well, folks, I hope you enjoyed the session. Certainly from the calls, I understand that I believe that you're all listening and following through. And Leila, thank you very much for being here with me. I hope we can continue that at some other time.
Absolutely.
When the opportunity arises and so forth. Because there's a lot more we could have covered. We had never done much into industrial audiology and a few other things. So thank you very much for being here, coming even at short notice. And thank you very much, Mr. Andre Paul, for having me around. Thanks.
Yes, so thank you very much, Dr. Surage, for your service, and thank you, Leila, for your presence.
Thank you for having us.
You're welcome.
Pleasure.
Yes. Okay, you've been listening to and viewing Doctor in the House on Rev-Up St. Lucia every Tuesday from 6 p.m. to 7 p.m. So join Dr. Surage again next week for another Doctor in the House, brought to you with the compliments of La Place Saint-Lazare, Ultramart, the Labrie Cooperative Credit Union, and Tapia Hospital.
At Tapia Hospital, we operate a 24-hour emergency service for all your urgent healthcare needs. Our qualified medical specialist will be on hand to ensure that you receive the best of care. Call us at 459-2617. Tapia Hospital, where the patient safety comes first.
At Labrie Cooperative Credit Union, we have one simple goal: to help you grow. Because when you grow, possibilities expand. We're about growing wings, growing ideas, growing you. This is your time. A time when your plans and dreams fall into place. When what you thought to be impossible with our support is indeed achievable. And best of all, it's a time when you can look back and see your growth. So, on life's journey, set your goals high. We'll be with you every step of the way. And as you grow, so should your opportunities. Labrie Cooperative Credit Union. We're not a bank. We're better.
Looking for a one-stop shop for all your grocery and household needs? Look no further than Ultramart. We stock a variety of options from the world's leading brands, all at affordable prices. Whether you're looking for fresh produce, pantry staples, or household essentials, we've got you covered. And that's not all. Don't miss out on our ultra specials and promotions for a chance to win hundreds of dollars in vouchers, hampers, and special prizes. Visit any one of our 4 convenient locations today or check us out on our Facebook and Instagram page. Ultramart, your one-stop shop for all your grocery and household needs. Shop smart. Shop Ultramat.
It's delicious.
La Plaza Salazar is the true home of quality meat and deli products, selected and priced to suit every palate and pocket. We sell all cuts of meat, poultry and fish, from tasty lamb necks and succulent pork chops to lean dolphin and juicy top round steaks. Our deli items include turkey, ham, bacon, pork sausages, meat patties, chicken nuggets, deli ham and eggs, so that breakfast or that party is a breeze. And for your added convenience, we sell restaurant essentials and grocery items. So where's your next meal coming from? La Plaza Salazar, of course. La Plaza Salazar, Castries, Groselet, Beaufort, and Soufrière.
It's delicious.
Rev-Up St. Lucia is located at Unit 4, Gablewoods Mall, Sunny Acres, Castries, St. Lucia. Tune in to us at 97.1 FM and online at revupslu.com. Call the